We can start now.
Hello and good evening. Thank you for joining this Bureaucrats India webinar. My name is Navneet Anand, and I'm joined by a very distinguished set of speakers for today's webinar, which is about celebrating the 100 crore vaccination mark achieved in a record time in India. We all know in India how this story is of great significance for us. It is not only world's largest vaccination drive, but it is also the fastest. We rolled out the first time ever rollout of vaccine within 11 months of the first case. That in itself is remarkable. There are many stories within that one big story of the 100 crore vaccination success. As we call it, we are vaccine billionaire. There are experts to share perspectives with us, but just to give a context as to why this webinar is important. Number one, if you look at the journey of how we started and how we scaled up, and then how we peaked. In Feb, we started in January. In Feb, we could manage just with 1 crore vaccines. In April, 2 months later, we reached 9 crore. In August, in 1 month I'm talking about, we could manage 18 crore. And in September, it was 23 crore. On 17th September, which happens to be the birthday of Honorable Prime Minister of India, there was a maximum number of doses given, that is 2.5 crore. It was a remarkable tribute to the power of India, to the vision of the Prime Minister, who had from the beginning said that nothing is impossible. There are varied data that point to the kind of success that was achieved. It was the vaccination was 2 times more than America, 9 times more than Germany, 5 times more than Japan, and 10 times more than France. Why this is also important, and I'm celebrating the medical side of the feat before we come to the administrators, because polio, if you have noted, it took us about 20 years to develop the vaccine. From the time it was established or developed globally and the time we started to deploy it in India, it took us about 20 years. Tuberculosis, it was 32 years before we started to make it in India. My apologies. This is about 100 crore number I'm talking about. It took us 20 years to administer 100 crore vaccines for polio between 1994 to 2014, 32 years from 1999 to 2021 in achieving that 100 crore mark. When it comes to developing of the vaccine, I think BCG, the first vaccine developed was in 1927. But we started to make it in India only 24 years later, that is in 1951, and administer it in 1978, started to administer in 1978. So that's the kind of story. I think there is another side of the story that once we announced in June, I think that it will be free, we saw a massive leg up, jump in the number of average vaccination. It was averaging about 18 lakhs before 21st June, when the Prime Minister announced that it's going to be free for all over 18 years, whereas it started averaging over 60 lakhs post 21st June. I think these and many other aspects, while we celebrated, and the Prime Minister tweeted on 21st, we are witnessing the triumph of Indian science, enterprise, and collectivist spirit of 130 crore Indians. Many, we were all on cloud 9. We were very happy, excited, and celebrating the success. Somewhere I thought the story of our administrators needed more magnifying. You know, the IAS officer, the district administration, the district collectors, the health workers, of course, all salute to them. This webinar is basically dedicated, of course, to the great work done by a lot of IAS officers on the ground and other officers. But also to take what it took, you know, so we have stories from Khuti and Raigad as to how this success was eventually achieved. What was the kind of model? We have a Indian expert in Padma Shri, Dr. Sanjeev Bagai, who shall be talking about the various policy aspect. We have a global expert in Dr. Tinglong Dai, who shall be giving that global perspective. He partnered with Dr. Ravi Mittal in developing a paper. We have Dr. Mrinalini, who is pursuing her PhD, having seen a lot of administrative handles, having handled Indian administration for so many years, has taken a break and is pursuing her PhD. I'll request, I'm joined by my very bright colleagues, Sweta, Vigya, Niharika, and Pooja in the backdrop, who are assisting us, who are behind this. We have Shamal from Transform Rural India Foundation, who has done a tremendous work of taking the vaccine to the grassroots. I'll request Sweta to begin by introducing Dr. Sanjeev Bagai. He needs no introductions, one of the most prominent and popular faces on Indian television. But I'll request Sweta to introduce us to Dr. Bagai before he starts his perspective as to how we must go from here on. Sweta, over to you.
Thank you, sir. Welcome all to this webinar. We are celebrating India's 100 crore journey, vaccination journey, great journey in itself. We have been joined by Dr. Sanjeev Bagai, the most panelist today and most experienced panelist. Dr. Sanjeev Bagai is an Indian pediatrician and a medical administrator and is known for his proficiency in pediatric nephrology. The government of India awarded him the 4th highest civilian honor of the Padma Shri in 2006 for his contribution to Indian medical sector. 2 years later, he received Dr. B.C. Roy Award, the highest Indian award for in medical category. We are truly honored to have you here, Dr. Sanjeev Bagai, and I request you to share your views on this 100 crore journey of India.
Good evening, everyone. Thank you for having me on panel. So I think this has been one hell of a period of 2 years. But needless to say, the vaccination journey and the rollout which India has displayed has been a brilliant performance. It's been precision oriented. It's implemented with great finesse, meticulous planning. The rollout has been scientific in terms of being vetted with the most updated protocols. The local logistics implementations have been totally immaculate. Right from the R&D to the manufacturing, to the production, to the distribution, to the local logistics, including the cold chain maintenance, the vaccination itself, the bio-waste disposal of the syringes and the needles, which are plastic and sharps, arrangement of the local manpower, which not only includes the doctors, but the nurses, the sanitation staff, the cleaners, the helpers, and a host of background administrators, which never actually get mentioned, but are actually a cornerstone. The ASHA workers, the huge amount of SDMs and DMs in the local districts, all of them coordinating the data maintenance in terms of IT has all been completely brilliant. This has been the fastest, it has been the tallest, it has been one amongst the safest scientifically vetted protocols. We started 30 days behind most of the American countries, and the first 10 crores took 85 days, and every 10 crores further down came down with the time period of 45 days, 29 days, 24, 20, 19, 13, 11. And now we are averaging about 9 to 10 days for every 10 crores. It's like vaccinating a couple of countries all together just before lunch on one particular day. And what this has actually done is it has dramatically decreased the case fatality in India. We have 139 crore population and we have a corrected case fatality ratio of approximately 310 deaths per million population. And US, for example, of 38 crores has a case fatality ratio of exceeding 2000 per million population. Why this vaccination is so important is on various fronts. We still haven't reached herd immunity. No country in the world has reached herd immunity. But what this has done, worldwide literature states that it decreases the infection transmission 8 folds, it decreases the admissions 25 folds, and it decreases the death rate 25 folds. Without doubt, it decreases the total viral load post-vaccination. So you have two aspects to this. One is community transmission and then host-to-host transmission. Both get muted and blunted. With regards ongoing in terms of the safety protocols, it's been absolutely immaculate. The side effects, what we call as vaccine-associated side effects, have been extremely low, 0.005%. The breakthrough infection rate in India has been just 0.2%. And that also would be very mild, more like an upper respiratory common cold. We've had no side effects of thromboembolic phenomena or anaphylaxis or any such myocarditis, pericarditis kind of side effects or adverse events which have been documented with some amount of other vaccines. I think we were doubted. We were doubted that we would not be able to manufacture it. Well, we did, and this has not only shown that we are not a vaccine hub. 60% of the world vaccines are made and distributed and used in India, but this has shown the finesse and the architectural layout of great depth of versatility of Indian scientists and researchers, in which the first vaccine to be made in India was the Bharat Biotech Covaxin, and it's been published in Lancet just yesterday to show, now it's peer reviewed, which everyone was asking, 77.8% overall vaccine efficacy, and for symptomatic and for severe cases, 93.4%. So I think the overall effectiveness on the ground has been very, very good. The gap maintenance in terms of the safety protocols, in terms of data monitoring post-vaccination, calling them for the second shots, and now India gets ready perhaps for the third vaccine, which people call internationally as boosters. I think internationally, most countries have fought off the vaccine hesitancy. So did India. We've fought off various kinds of religious angles, like most parts of the world. But I think overall, the drive has been hugely successful. This would not have been possible without the leadership of the Indian government and single-handedly leading from the front of respected Prime Minister Modi. I think he's taken a lot of flack, which was undue for him. But I think you need to give credit where it is duly deserved, and so it is to him. He went down to the manufacturing hubs, not only in Bharat Biotech and Serum Institute in Pune, but in Gujarat and various other places. He's had frequent meetings with the state ministers, with the local STMs. He's even interacted one-to-one with the various healthcare professionals. And in the end, I think it's more when you win such a long war or a battle. I think the first step is you need to win it in the mind. It's more a mental victory, and the greatest victories are first won in any match. It's in the head. And I think we broke down the marathon into smaller parts. There were various things which, in terms of 11 major addresses to the country, I think overall it's been very, very good. It's been successful and full merit, but we can't put a guard down. So the simple message as a summary point in this session of my talk in this segment is, don't forget your masks. In spite of your 2 vaccines, before your vaccines and after your vaccines, we know that you can be an upper respiratory carrier of the virus in spite of vaccination. Do not attend unnecessary social gatherings, maintain your COVID appropriate behavior, and become a mask ambassador and a vaccine ambassador. This is an unforeseen event the world has seen, but I think we are reaching somewhere close towards the end. We can't look back. We have to look forward for the new world. Over to you.
Thank you very much, Dr. Bagai. When it in the mind, and Prime Minister naturally did it very, very well. We owe him gratitude for this. Dr. Bagai tells us be a mask ambassador as well. Now, going to the next speaker, we have a global expert. A lot of figures that I spoke about, Dr. Bagai is speaking about. We have Dr. Tinglong Dai from the Johns Hopkins University of the USA, and he's going to share with us his insight. But before, I'll request Sweta to please introduce Dr. Dai to us.
Thank you. Dr. Tinglong Dai is a professor of operations management and business analytics at Johns Hopkins University, Carey Business School, with a joint appointment at Johns Hopkins School of Nursing. At Johns Hopkins, he is on leadership team of university-wide business of health initiative and the executive committee of the Institute for Data Intensive Engineering and Science. At the foremost, he's an expert in healthcare analytics. Dr. Dai has been quoted in several media on numerous occasions. In 2021, he was named one of the world's best 40 under 40 business school professors by Powers and Coates. Dr. Dai, we are truly honored to have you here, and we look forward to listening from you, the global perspective on this vaccination drive. Over to you.
I must, sorry for this brief interruption, but I must tell my viewers, the audience, esteemed audience of Bureaucrats India, that Dr. Dai, in association with another panelist, Dr. Ravi Mittal, did a paper on how what it took to succeed or to achieve 100% vaccination in Raigad district of Chhattisgarh. We shall know more on this from Dr. Ravi, but over to you, Dr. Dai.
Thank you. Thank you very much, Dr. N, and also Shrita, and all the organizers, distinguished fellow panelists. It's a great honor to be part of this panel. As mentioned earlier, this is more for me of a learning opportunity rather than sharing what I know, mostly about the US and a little bit about the rest of the world. But I will try to keep it really, really brief. But let me start by saying that telling you a little bit about my family connection with the India administrative services. And, obviously I'm not from India, right? But I did my PhD from Carnegie Mellon University, where my advisor, Sridhar Thayer, who is one of the founding fathers of the field of supply chain management, he really kind of defined the field of global supply chains. So Sridhar Thayer, he is a proud child of India Administrative Service Officer. And he has told me a lot about this system, how wonderful it is, how much he has learned from this family. So in that sense, this is really my family connection with this system. And so the other connection I had, obviously, as Dr. Anand has introduced, is through working with Dr. Ravi Mittal and Dr. Shubhri Jain and Dr. Amit Jain. So Dr. Amit Jain here is a surgeon and associate professor here at the Johns Hopkins School of Medicine. And unfortunately, he couldn't make it today due to his surgical schedule, obviously. So yeah, but that's my connection to this family. So I thought, this is amazing. You guys are doing this on Friday evening. I wouldn't do this on Friday evening. And the other thing is that, as Shrita mentioned, my perspective is a little bit more global. And having seen how vaccination, this progress has been made over the past 10 months also, I must say this is 10 months, 11 months now. So this is a truly fantastic situation. And we are, talking about a medical miracle has been made. There's a date I like to talk about a lot, which is January 13, 2020. January 13, 2020, that was well before WHO coined the term COVID-19, right? It's like nobody even knew about the term COVID-19. So that was January 13, 2020. That was the date on which Moderna finalized the design of a COVID-19 vaccine. So even before the world knew about the COVID-19, And the COVID-19 vaccine was already developed here in the US by Moderna, actually in partnership with the National Institute of Health. So it just shows the incredible, miraculous pace of innovations. But then the problem is that COVID-19 pandemic didn't disappear after that. If anything, it actually got worse, right? So that just shows that vaccines do not really save lives. Vaccinations do, right? So that's why the work you have achieved is just incredible, remarkable. So I I have been watching the progress that have been made here, and also as Dr. Bagay pointed out earlier, you look at the speed, look at the pace has been made in India just over the past few months, despite all the difficulties, all the shortages at the very beginning, like all other countries had experienced before. This is just miraculous, just remarkable, and this definitely deserves celebration. And the other really unique aspect about the vaccination campaign, if I understand correctly, from working with Dr. Mito and also Dr. Jane, is that this isn't really based on financial incentives or based on a lot of punitive measures. And this is really based on the fact that recognize strength from the people and really collaborating with the people and recognize strengths of a society. And this is how you achieve this tremendous success. Because in the US, this approach has been mostly about, oh, we're going to spend another $1 billion. We're going to do this lottery program. And if you are not vaccinated, you cannot go to a restaurant, you cannot go to school. So mostly based on this carrots and sticks kind of approach, mostly based on human incentives. But from work with Dr. Mito and Dr. Jian, what I have learned is that that may not be the only way or even the best way of doing things, right? So the best way of doing things is really to understand the strengths and the wisdoms we have from the people, and then try to do things to maximize that power. So this is really something I have learned from this invaluable working experience. And I try to keep my speech short, so I'm going to stop here, but I look forward to learning from everyone in the rest of this important event. Thank you again for having me.
Thank you, Dr. Dai. That was sweet and very, very insightful. You truly and rightly call it a medical miracle and a miraculous space of innovations that we were all stunned with. And salutes to all the doctors and scientists and, of course, the frontline workers. What makes this India's 1 billion vax success, PM's vision and Steely resolve for bureaucracy webinar special is that we have 4 doctors who are IAS officers and who are very kindly agreed to share their perspectives with us. So this is going to be further fascinating after 2 experts speaking. Now I request Sweta to please introduce to us Dr. Mrinalini Darswal.
Thank you, sir. Dr. Mrinalini Darswal is a senior IAS officer. She is from 2002 batch. She has served as collector and district magistrate in several districts. And during her time as an IAS officer, she has managed various of issues, including development, poverty alleviation, maintenance of law and order. She has keen interest in academics and has degrees across economics, philosophy, psychology, public policy. And currently, she is pursuing her doctorate from Harvard T.H. Chan School of Public Health. She was nominated for UT's President's Award for Global Learning in 2020. And we are honored, glad to have you here, and we look forward to listening to you.
Thank you, Sweta, for such a wonderful introduction. Namaskar to everyone who is watching us today. Thank you so much, Navneet sir, for giving me this opportunity. I'm delighted to be joining this illustrious panel today. Dr. Bagai, Dr. Dai, Dr. Lakshmanan, Dr. Tyagaraj, Dr. Shashi, Dr. Mittal, organizers, the viewers joining us today, and the citizens of India. I heartily congratulate all of you for having achieved this tremendous feat of getting more than 111 crore shots of COVID-19 vaccines in the arms of Indians. Without a doubt, that was made possible by the able and exemplary leadership of our dear Prime Minister, Shri Narendra Modi ji, and his direct and close monitoring of the situation on the ground. We know his keen vision reaches even the remotest nooks and crannies of our gigantic geography. Highly praiseworthy is our leadership's unrelenting commitment and effort at the districts and at the grassroots, including that of our panelists. But my awe and special thanks are reserved for our frontline and health workers, Anganwadi workers, multipurpose health workers, and ASHAs. And what makes me especially glad is our Prime Minister's appreciation of women leaders and his appeal to emulate their examples to get better results in vaccinating everyone in India. We are getting global accolades because we achieved these remarkable results by deploying our in-house genius and ingenuity. And that too, within 9 months of the first shot was delivered in India in January this year. And that is like Dr. Dai has told us, Dr. Bagai has told us, that's like unprecedented anywhere in the world. And we manufactured our own vaccines. We were self-sufficient in our fight. And with all of that, we have been able to provide every 100 Indians with 81 shots till today. And that places us far ahead of our neighbors and just a tad bit behind China. But we still have a long way to match the rates in developed countries, which have now started vaccinating children and also giving booster shots. However, like Dr. Bagai told us that we have done better than most in the infection rates and case fatality rates because we are a relatively younger nation. And this epidemiological advantage combined with our continued watchfulness will undoubtedly help us contain this virus to a level where it is no longer a major public health emergency. The evidence indicates that this virus is not going to go away entirely, at least for many, many more years. Let me touch a related issue here by saying that COVID containment is about preventing new infections with measures like mask wearing and vaccinations, but it is also about managing existing infections and if necessary in hospitals. Unfortunately, we have a very successful example of doing both from a very early stage of the pandemic, my state of Odisha. The state has achieved 100% coverage among the healthcare and frontline workers, and 89% of them have received their second dose as well. And every district in Odisha has a dedicated COVID hospital with oxygen-supported beds and ICU facilities. Even the coverage in the high-end tertiary hospitals is entirely free of cost. It is funded by the government without any ceiling. And in Odisha, we have an excellent example of this synergy and dealing and the governance during health emergencies. And the entire effort is led very, very ably by our Honorable Chief Minister, Mr. Patnaik, and the 5T Secretary. And we can actually measure success of Odisha in the evidence that Odisha has some of the lowest COVID-19 death rates, not only in India, but also in the world. Experts say that for achieving herd immunity, we might have to vaccinate 70 to 85% of the population, but the boosters may be required to keep the disease in check. The good news is that manufacturing capacity is increasing, new vaccines are coming in, and potentially the best news of the century after vaccines may be the specific COVID-19 pills developed by Merck and Pfizer. The combination of vaccines with pill might be the final nail in the coffin of COVID-19 pandemic. And with guidance and support from our Honorable Prime Minister, Indian pharmaceutical industry is again leading the world in this field, in manufacture of the pills. However, there is a note of caution also when I say this, because new strains led by the highly transmissible Delta variant are causing renewed outbreaks all over the world. We need to be watchful of that for India also, because we were blindsided by the second wave. But I hope we are much more well prepared this time. Israel saw another surge of cases brought under control by offering boosters. And many states in the USA are also witnessing a resurgence, and hospital capacity is getting overwhelmed again. That is a cause of concern. But worldwide, we see that this thing is occurring more among the unvaccinated people. And in the US, we are calling it more of a pandemic of the unvaccinated now. And even among the vaccinated, the Delta variant may lead to mild cases. And this is a very peculiar feature of this virus, is that the infected people, even though they do not get the symptoms, are capable of spreading the virus. So, but however, the vaccines do remain effective, like Dr. Bagai told us, in preventing hospitalizations and severe diseases. Another thing which we have to keep in mind is that immunity after infection and vaccinations wanes after in COVID. So there is a necessity for having boosters. We may keep ourselves ready for that. Vaccinating children is also essential for achieving herd immunity. Continued vigilance and adoption of appropriate COVID behaviors like mask wearing, distancing, hygiene is going to remain crucial. But one thing, special thing to focus on during the winter months is ventilation, because people will gather more indoors and they will be constrained to be close together in private and public spaces. COVID virus lingers in the air and it will potentially get more opportunities to spread in the coming months. And rising air pollution does not help either. So although it is very difficult as a behavior, but wearing masks indoor and avoiding crowded spaces will be very important during the winter months in India. We are fighting the war against the pandemic on multiple fronts. India has shown exemplary leadership, coverage, results in containment, despite being a humongous country. The able guidance and effort of our Prime Minister Narendra Modi ji has kept us safe. Every Indian must be vigilant, at least for ourselves and for our immediate families, and do our best to strengthen the hands of our Prime Minister to defeat the virus. He gives us a call of Har Ghar Dastak, means we must knock on every door. Ghar Ghar Tika means reach the vaccine to every house, and Har Ghar Tika, that means cover everyone, and urges us to reach vaccine to every single household of India with a proactive outreach. He calls for leadership from every citizen of the country when he says, every one of us must motivate at least 3 to 5 more people to get vaccinated after we have taken our shot. And like him, I completely believe together we can, and we will defeat this disease and get our nation back to the path of normalcy and progress while providing leadership to the world. Thank you very much.
From an academic, a doctor, an administrator par excellence, that was a brilliant exposition and the articulation of a very complex subject. Thank you so much, Dr. Mrinalini. As usual, always a pleasure having you on this platform. My dear friends, you're watching a webinar on 100 crore vaccination, the 100 crore story, and the Steely resolve of the bureaucracy. We are celebrating the role of the bureaucracy, and we are joined by doctors turned bureaucrats, along with some globally known experts. Now, my colleague Vigya, I'm very tempted to quote from Honorable Prime Minister Narendra Modi's write-up that appeared in the Indian Express, and everyone must read it. He talks about Jan Bhagidari, how it made possible. He talks about the Bhagirath effort, how 41 lakh man days or 11,000 man years was used. He talks about the formation of the expert groups and what it took to reach the vaccination policy, how the regimes were liberalized. Especially noteworthy has been the last mile delivery. And we shall hear from Ravi and Shashi about what it took to take it to the remote areas. And we have somebody who did it on the ground from Transform Rural India Foundation. But before we go, can I request Vigya to run that very short clip from Prime Minister to
Yes, sir.
Remind us of the kind of magnitude that we did it?
Yes, sir. 1 minute.
Good evening, everyone. Am I audible? This is Tyagarajan DM Darbhanga.
Yes, sir, you're audible. You're audible.
Thank you. Hello. Hey.
Vigya, is it a problem? We can do it after the next speaker, please.
I think we should move on.
Yes, Sweta, can I request you to please introduce Dr. Lakshmanan S. He's somebody I have personally seen working very closely because we have seen how Assam has been extremely aggressive in managing the COVID pandemic. Sweta, why don't I get away from between you and Dr. Lakshmanan and let him do the talking, and after your introduction, please.
Thank you very much. We have with us Dr. Lakshmanan S., an IAS officer by training and a doctor by education. He is currently posted as Mission Director, National Health Mission, Assam. He's a 2011 batch IAS officer, and he has served as Subdivision Officer of Sadia, Additional Deputy Commissioner of Tinsukia, Deputy Secretary of Guwahati Development Department, Joint Secretary of Health and Family Welfare Department, and Deputy Commissioner of Hajoi. As a Shiv Sagar Deputy Commissioner, Dr. Lakshmanan has been honored with Excellence in Governance Award. The award was bestowed upon him by a leading media company, Indian Express Group. We are truly honored to have you, Dr. Lakshmanan S., here with us today. And since you have such a diverse experience in health sector, we are looking forward to get some insightful experiences from you. Over to you, sir.
Good evening to all experts present and participants here. First of all, it is indeed a great experience to hear and learn from experts like Dr. Bagai, Mrinalini ma'am, Dr. Dai, and the subsequent speakers as well. Actually, the moment we started discussing about COVID,
Yes, ma'am.
the way Prime Minister took over. Am I audible?
मैम हमारा स्क्रीन पूरा हैंग है एक बार आप श्वेता को बोलिए हमको निकाल ही दे इसमें से
Okay, all right.
Yeah, am I audible?
Yes.
Okay, yeah. Sorry for the disturbance in between. Coming back, in fact, this COVID vaccination campaign undertaken in India is unique, and it is one of the largest free vaccination campaign in the world without doubt. Population wise, of course, China has done much more vaccinations than us, but the kind of digital certification, the kind of efficiency shown by all the states has been wonderful, and the lot of credit for getting this thing done goes obviously to the visionary leadership of Honorable Prime Minister. Similarly, to the bold, brave, and aggressive steps taken by each of the states. Irrespective of the size, irrespective of the magnitude of population and the challenges thrown out because of the varying geographical natures, I believe all states have done wonderfully well. Congratulations to each one of them. Coming back, obviously COVID vaccination cannot be kept apart with the two waves of COVID pandemic as well. When vaccination started way back in January 16th, we did not even thought about, we did not even envisage about a second wave hitting us very soon by March and or April. But despite the second wave of COVID, which was much more troublesome, horrid, and at some point of time, helpless situations happening in many states, COVID vaccination parallelly gained strength from strength and got implemented in a beautiful way in almost all districts. I would limit my comments only on the middle level bureaucracy. As you already see, Government of India came up with a very, very clear vaccine policy, keeping all stakeholders together.
Dr. Lakshmanan, is there a problem with your video, or you are somewhere?
Yeah, there is a problem with my video. Apparently, I am unable to see you too.
Oh, I see. Okay. Okay. All right. Please carry on.
Yeah. See, Government of India, when they started this program, they had a very, very clear planning stage with national expert group on vaccination, NEGVAC. Fortunately, Assam was also part of this NEGVAC group, and we could learn how things are being envisaged, starting with availability of vaccination, parallelly matching it with different age groups. When we started with above 60 years, then 45 with comorbidities, then 45 plus, all 45 plus, then 18 to 44. Prior to that, ensuring that all healthcare workers and frontline workers are properly saved. So this had happened with lot of thought process in the higher level, which actually helped the middle level bureaucracy to translate this into doable actions at the field level. Obviously, the deputy commissioners, the speakers who will be succeeding me will be speaking upon how they did it in the district. While I am speaking, how we had to envisage different steps to be done in the district in tune with the instructions which we were getting from Government of India. So at the middle level, actually, it is about keeping constant touch with the districts, understanding their problems, keeping constant touch with Government of India to properly know what is the current guidelines, what is going to be the flow of starting with vaccine, syringes, all other things. At the same time, keeping the state level political leaders in the loop so that the whole program is owned, guided, and implemented with approval of the state's authorities. So I think in that way, Government of India actually systematically utilized the bureaucracy in the best possible manner. And this also is a good example that when there is a will, especially political will, the bureaucracy, the citizens, the whole society responds to it in a very, very positive manner. And at this point of time, let me add one more small point. At this point of time, when we are celebrating 100 crore plus, almost 110 crore vaccination has already been done in the country. It is very, very important to understand that every state has contributed for this success. There are states like Uttar Pradesh, Bihar, Maharashtra, who have done more than 10 crore vaccination. West Bengal for that matter. But equally important is the contribution from Andaman, Lakshadweep, Daman and Diu. They might have less than a few lakhs of population, but making sure that they have done 100% vaccination of each one of them is equally, if not more, difficult of reaching out to 10 crore people who are otherwise available. So as we are almost reaching to 100% target achievement, Har Ghar Dastak program undertaken as per the vision guidance of the Government of India, Honorable Prime Minister and Health Minister. It is indeed an opportunity to reinstate or reinforce the ability, the efficiency of bureaucracy to get a thing completely done in the best possible manner, in the best interest of the public. I'm sure when we take up with the districts during vaccination program definitely faced multiple challenges, starting from vaccine reluctancy at some point, having more people eager to take vaccine but not having that much vaccine stock. Now coming to a situation where there are a few people only missing, but they are too much spread out. So a variety of challenges have been faced by the district. Despite all these things, the deputy commissioners or the district magistrates, the whole district level health teams have coordinated beautifully with the state bureaucracies. Similarly, state bureaucracies have taken up each and every issue with Government of India. And this is one good example where all governments, starting from union government up to the level of Panchayati Raj institutions, have worked well. And obviously, the so-called bureaucracy did play a part in this thing. And that has been a wonderful effort for the whole country too. Thank you.
Thank you very much, Dr. Lakshmanan. You have been spearheading a very good campaign in Assam, and compliments to that. I have, as I said, personally been witness to the kind of work being done under the leadership of Honorable Chief Minister Dr. Himanta Biswa Sarma. Before we go, are we ready with the audio or video, Sweta, or we can go to our next speaker? Okay, all right. So we'll go to now next three speakers are those who have actually done it on the ground. Dr. Lakshmanan also is the mission director of National Health Mission in Assam, but Dr. S.M. Thiagarajan, who is again a batchmate of Dr. Lakshman, 2011 batch IAS officer, and is currently serving as the district magistrate of Darbhanga in Bihar. A doctor by education and IAS by training, Thiagarajan ji has played a key role in managing COVID crisis and vaccination drive in the district. We have also had the opportunity of working very closely with him because of one of the ministers, Honorable C. Sanjay Kumar Jha. He comes from that region. We work very closely with him. Under Thiagarajan ji's leadership, Darbhanga continues to be one of the districts with highest inoculation rates in Bihar. What makes it even more praiseworthy is that Darbhanga was also facing a double whammy of floods and COVID, and Dr. Thiagarajan had a task cut out for himself. Let's hear from him as to how he managed to come out with flying colors out of this double whammy. Dr. Thiagarajan, over to you, please.
Thank you. Hope I'm visible and audible to everyone.
Yes, you are. Your work is also very highly visible, audible, and very loud. Thank you.
Thank you so much. So let me extend my thanks for gratitude for inviting me for this session, and one, because I can share my experience, which can be helpful for others, and it's a sort of a recognition for us as a team. And secondly, I could meet some of my friends, as you rightly said, Dr. Lakshman is a batchmate of mine. So, so though I cannot see him, I could at least hear him. So, so let me start by saying that once the second wave happened, it was so bad, as everyone knew. Only way out of that and the prevention of third wave was vaccination. There was no other way out, since there was no medicine as such, curative medicine available for COVID. It is even now it's not available. There was only a symptomatic treatment. And but the pandemic is such that the scale of the pandemic is such that you can have all the infrastructure in place, but it would just not be enough. Because it's just a pandemic, it's everywhere, and when it hits you hard. The second wave was really so bad. So vaccination was on the top priority for everything else to fall in place, right from the economy and other things. If they have to fall back on track, we needed vaccination. So when we started the vaccination drive, it was on the top priority of the district administration and also the state government. With the clear directions from the central and the state governments, we started the drive, and we knew, as every year we have been facing floods, this year also we face floods, and out of the 324 panchayats in Darbhanga, we faced massive floods in 234 panchayats. Despite that, as we stand today, we have achieved 72% of first dose inoculations and 42% of second doses. And initially it was very high, and we prepared ourselves for the flood period, because it was really difficult. Once a flood happens, eventually people will have to stay together in relief camps or in places wherever the higher altitudes are available. So people have to stay in close proximity, which is which is totally against the COVID norms in place. So, but we took that as an opportunity to vaccinate people in those camps. Wherever people started migrating, we started session sites. So our session sites were dynamic. We every day it used to change, and we used to cover large number of people. For example, 1,000 people were in a session site. We used to have 5 session sites. 200 was the maximum size of each session site. So we used to have 5 session sites at the same place to vaccinate 1,000 eligible population. So it was a very dynamic and dynamic strategy. With the everyday monitoring was extremely essential for the success of the vaccination campaign. Otherwise, it would just not succeed by having established system sites repeating themselves, which can be a success in a plain area without any disasters. The second thing was the use of boats and the teams. For example, in villages where even now some of the villages are surrounded by water, so we send the teams the day before. The teams go and stay in the village the day before they start the vaccination early in the morning, because it could take 2 to 3 hours for a team of ANMs to travel through water to reach the village. So they reach in the evening, and the next day early morning they do it, and they return by 1 or 2 o'clock. It's an extremely difficult situation. It was extremely difficult for them, but they really delivered. The ANMs, ASHAs, and the doctors. So the success of vaccination drive amidst floods was a dynamic strategy with daily monitoring, basically with hands-on approach. There could not be a standard approach which could be followed, and along with the floods in the initial stage of vaccination program, there was a resistance from certain pockets of the population. For that, we held meetings regularly with the community leaders, the village leaders, the religious leaders, all the political leaders. Many rounds of meeting at every level, from the district to the block to the panchayat level, were held to convince people. But happily, once people were convinced, they started turning out in large numbers. So, vaccination drive never became a problem. And what helped us a lot was the transparent and the comprehensive nature of CoWIN portal. That gave us a very, detailed database, and it is so transparent, and you can generate the due list of the second vaccination from the CoWIN portal. So effective use of CoWIN portal was something I would say as one of the reasons for the success of the drive. The strict implementation of the directions we see when it's in the initial stage, there was vaccine shortage. We had to vaccinate, a large target, but we were given strict directions to start with the frontline workers, the healthcare providers, and then move on to the 60 plus and other vulnerable population, and then later on 18 plus came into the picture. This strict implementation of this was extremely important because there was demand from various sectors, various important positions, but to circumvent the rules or the directions. So we just didn't do it, because once it is done, that would there be a chain where the vaccination program could fail. So there was 100% strict implementation. If we want to vaccinate the healthcare workers or the frontline workers, only they will receive during that period, and none else will receive. I mean, we also waited till our turn came. So that was how strict it was, and. Later on, as I said, it's a dynamic strategy, and from session sites, we have moved on now to mobile teams, door-to-door surveys. There was a 3-day survey period in Bihar where all the houses were surveyed on those 3 days, and people who have not been vaccinated have been listed out. So we could vaccinate them immediately after that. And as you rightly said, Bihar has vaccinated more than 10 crores. One of the reason was there were many vaccination days, mega vaccination days. Still, Bihar holds the highest number of vaccination on a particular day. On the Honorable Prime Minister's birthday, it was. I think we crossed about 35 lakhs. So it was in a single day. So the drives were perfectly strategized, and we put all the resources into place. Darbhanga, I think, achieved 1.5 lakhs on that day. And another thing we did was, Darbhanga is a district with a large number of migrant population. 2019 COVID period saw a huge number of migrants returning, and we had prepared a database of migrants during that period. So that database also helped us in evaluating the to be vaccinated people, and we contacted them over phone, and we ensured that they are either vaccinated outside Darbhanga or whether if they are in Darbhanga, they're actually vaccinated. For this, we made use of the Diwali and the Chhat period. Chhat is a major festival in Bihar, where all the migrants, almost all migrants return to Bihar in this period. So this period, Diwali and Chhat, we made full use of. Just before that, we held that survey, and thus our percentage, Darbhanga was 67% of the total population of eligible population of 27 lakhs. By the way, it is a huge district with population of 52 lakhs, but the eligible population is 27.6 lakhs. So out of that, 67% was were vaccinated on the 3rd of November, and by 10th of November, in a week, we jumped 4%. Now we are 72%. So that was basically because of proper surveying and making use of the window of Chhat and Diwali, where people actually returned back. So all these strategies combined together have yielded us results, sort of make us feel that we are in a safe and comfortable zone for the time being. Second dose, again, there is a lot to be done. We have started laying equal emphasis on first and the second dose. Initially, our emphasis was on to cover maximum first dose people. 42% is the achievement of second dose, which is I think closer above the national average. But we are on the job. The due list is out, and now we are approaching the villages through bikes, motorbikes, where ANMs are reaching house to house. Now the floods have receded, has given us the extra leeway to make a better coverage. So yes, I mean, these are the strategies, I would say, in the district of Darbhanga, and I mean, it's a combined effort of the central, state, district administration. More importantly, participation of the people has been tremendous. Once that initial resistance was broken, I think people really came forward. Once they realized that this is really effective in preventing the third wave, they really came forward, and the discipline and the enthusiasm they have shown. Hats off to the people of Darbhanga, and as Dr. Lakshmanan said, the whole of India as well, which is a huge campaign. It's not easy to vaccinate 110 billion odd people in this in a short span of time. So that is all from my side, and let me extend my sincere thanks to the Bureaucrats India team for inviting me to join this meet. And I hope the information I have shared were quite useful, and I'm eagerly looking forward to hear from other experts as well. Thank you.
Thank you very much, Dr. Tyagarajan. And it is such remarkable work that prompted us to choose the title Steely Resolve of the Indian Bureaucracy. You had to work at multiple levels, from managing logistical nightmare to addressing behavioral issues, motivating your team. And I mean, I'm sure many of us would remember that nice photograph of a boat traveling down to potential eligible people who are to be vaccinated in Bihar, and that was really viral. It was a classic case of, to borrow Prime Minister's quote, Jan Bhagidari and a Bhagirath effort. Thank you very much, Dr. Tyagarajan. Continue to do the great work. You are joining this, my dear audience, my dear viewers. You are participating in this webinar on Bureaucrats India platform, one of India's foremost platforms to celebrate the stories of good governance and bureaucracy. Our next speaker, I'll request Sweta to please introduce, who is also a district magistrate. Sweta, over to you.
Thank you. Next, we have Shri Shashi Ranjan, IAS officer of 2014 batch, who is currently district collector of Kunti, Jharkhand. He is the only engineer amongst all the doctors that we have today in the panel. He's a graduate of prestigious IIT Kanpur. He's an electric engineer by education and an IAS officer by training. Previously, he has served as IG, DDC, and assistant collector at Dhanbad, Ranchi, Chhatra. He has done a remarkable job in his district in field of development and various other sectors. Today, he'll be sharing his experience of vaccination, challenges faced, and how it were overcome. Over to you, Shashi sir.
Thank you very much for having me here. Thank you, Bureaucrat India team, and Dr. Anand and all the person here to give me a chance to share my experiences of the Kuti district regarding the vaccination. So I must first of all give a brief introduction about the Kuti district and about population and geographical conditions. So here in Kuti, we have like 80% people who is from Munda tribe, like and the terrain is quite difficult. We have facing with the LWE, left-wing extremism area, and these tribes are like it's very difficult for them to convince that for a certain kind of things. And when you talk about the vaccination, there was huge rumors that this vaccination can cause you a lot of problems. So it was really a difficult task in initial days, and the IEC activity which we are thinking from the upside, it was not working on the ground. So it was a really difficult task. So for that, we started our whole scenario of vaccination through like election management cell. In election, we have different departments, different cells, different cosangs to do the certain works. Here also we make the different teams for doing the vaccination drive. So for this purpose, we use the community mobilization, and for the community mobilization, we used the teachers. Teachers are still considered as the most knowledgeable person. They are having the local knowledge of Mundari language and all those areas. Like this Kuti district is famous for these Munda people, and where you will find that all the reverend person like Birsa Munda, Gaya Munda, Jaipal Singh Munda is from this district. So we use these people, these teachers, to mobilize the community, and along with that, we also use the SSG workers, self-help group workers, Pradhan, JSLPS, World Bank supported Tejaswini group to do the community mobilization. And in initial days, we have did the meeting with the Mukhias and Gram Pradhan. In fact, where the people are not agreeing to take the vaccination in those areas, we attended the Gram Sabha in the morning, like 7 or 8 a.m. And we tried to give the information that why it is beneficial, why it is useful for them. So it was really a huge challenge for us. And then after that, when it was still not working, then what we did that we mobilized entire district administration force in one panchayat first. That is Chalkat Panchayat of the Tulpa block. And in that panchayat, we used all our resources to convince the people through the information sharing that why it is important. When we did all the community mobilization, then all the people came forward and took the vaccination. And it was a great energetic and achievement feeling for us that we completed our 100% vaccination in one panchayat. And this created a lot of buzz in the entire district that, okay, one panchayat is taking the vaccination and nobody is getting any harm. So it can be replicated in the other panchayat, other blocks also. So this was a huge success huge, I can say, outbreak for us. And then after that, we do the interactive sessions with the people where they have lots of doubts, lots of misinformation or rumors, and we used to give them the exact information, why it is needed and what is the purpose of it. And after that, we mobilize our health workers, because the terrain of the Kuti is not so conducive and the movement of the people is also very difficult. So what we did that we used the Panchayat Bhavan as which earlier used as a CVC, and where the people used to stay. So we asked our ANM worker and Asa Didis to stay in the Panchayat Bhavan, mobilize the people in the late night through Ratri Chopal and give the go for the vaccination tomorrow, next day morning. So this is creating a buzz. This was creating a lot of information to the people that okay, so they are staying with us, and if something happens, they are liable for it. So they started their trust started increasing, and they started taking the vaccination. These people, what they did initially, that they give the pamphlet where all the information about the vaccination was there. And since they have seen the 2 lockdowns, during the lockdowns they were not able to move anywhere, and they knew through the media, through the social media, that why how the COVID virus is very dangerous to the people. So they so through the audio video visuals, particularly in the Mundari language itself, we try to convince them. And this communication really worked on the ground. So actually it's looked like that we are again repeating the word IC, or convincing to the people, or doing the interactive session. But it was a huge and mammoth task, because we have to convince each and every villages or tola. So it's very difficult. When we say that we are convincing to the people, it's not so easy on the ground, because today if you convince somebody, tomorrow again some other person will give the misinformation through WhatsApp, through social media, and through other channels, and then again we have to do the whole process again and again. So it was a very tedious task. So for this purpose, we also use our resources like the Pradhan, which they have very deep-rooted connection with the people, because they are working with the people from the last 15 years. So they started convincing the people that okay, so Didi should come first. So initially, those persons who are the member of SSG, self-help group, or Mahila Didi, so they come forward to take the vaccination. Once they convinced that nothing is happening now, after that we are mobilizing their elders one or their family members to come forward and take the vaccination. So it was, we are really grateful to them, these ASA workers, that they did a remarkable work on the ground. So I must say that in initial days, women in our society played a major role in the vaccination process. So after that, when we succeeded in few panchayats, 3 or 4 panchayats, then what we did, that we used these persons who are the mobilizer of in these panchayats to share their stories in the other blocks, other panchayats, other far-flung areas, where they used to go, they used to speak in their Mundari language, and they used to give the information why vaccination is important, and what kind of precaution they should take after the vaccination, and who are the people who should not take the vaccination. So these things work on the ground when we did bit by bit, when we moved from one place to another place. And during this, apart from this, we also tried to improve our health infrastructure. For the improving the health infrastructure, we tried to provide the 24-hour electricity to all the CSC this community health center, and through the solar lights, we improved our health infrastructure in all PSC and CSCs. And after that, we also tried to increase the COVID testing center through RT-PCR and rapid antigen test. And along with that, we also get a huge number of oxygen cylinder and O2 generation plant. So as on today, all the district hospitals are having the oxygen supported bed in the Kuti district. So these were the few things which we tried on the various level to inculcate to improve the infrastructure things in the district. And after that, through and again on the while doing the community mobilization, we tried to convince the local vendors that if people show their vaccination card that they have taken the vaccination, then you must give 5% or 10% of discount to these people. So according to their convenience, they also try to give the discounts, and also this act as an impetus to the people in the urban area, in the Kuti city area. So these were the things which we tried our best. And after that, our vaccination percentage, which was initially like 10 to 12%, and when the people are not coming forward to take the vaccination, now it has improved around 70% in the entire district. And in Tulpa block, where we did the experiment, we have achieved 99% of the vaccination of the first dose and around 70% of the vaccination of the second dose. And we are hopeful that in coming days, very early, we will able to achieve our vaccination and do the complete our the mobilization of the people. So this was from my side, and we will try our best that we will do certain good things also in the health field. Thank you very much.
Thank you very much, Shashiji. That was very, very insightful to learn from your experiments. And before we go to one of the biggest newsmakers who achieved this 100% success, Dr. Ravi Mittal, I would request our friend Shyamal to please very briefly share his experience, because we'll complete the first round and then we'll go to the second round. Shyamalji, can you quickly share your experience about Transform Rural India Foundation? How did you go about achieving this success and assisting the district administration?
Yeah, thank you very much for giving us this opportunity to share. So before move forward, what I found that once we talk about 100 million or 1 billion vaccination, I found it that 4 areas which has to be celebrated. One is that commitment. Obviously, the commitment of these district collectors, the leaders, and the people to get vaccinated. So the people was also committed that they should get vaccination. The second thing which we found is the collaboration. Is the collaboration among the people, collaboration with the philanthropics, collaboration among the NGOs, and the many more who had came forward to support district administration, the government, and make it a success. Third thing which is more interesting is the coordination. We have never seen that how government can coordinate internally. Although it was a vaccination, it was a health program. But in our experience, we have seen that even the police department was part of the vaccination. Initially, as a social worker, we are very surprised that what police will do into vaccination. Then we realized, yes, it's required that enforcement, ensuring that vaccines will reach to that its destination, and also handling the chaotic scenario. So the different department they have coordinated, and the most importantly is the community involvement. So many people has already shared into it how they have mobilized. Particularly Shashiji has already shared his experience of engaging SHGs, PRIs, and other members together. But if we look into the vaccination, then we look into in 4 phases from day 1 to today. First phase was a confusing phase. Once it has came, whether I will take or not, whether it has some other agenda of Prime Minister or the political willingness to, in a different way, it has created the confusion among the people. The second phase, I call it as a negative or a collapse or a collapse phase, because once the first phase was started, then immediately second wave came, and whatever was starting that in the first phase, the stepping stone was taken. Then with the second wave of surge of the COVID, then everything was collapsed and people has become very, what I'll say that they have lost that that area. The third phase was chaotic, so everybody wanted to be vaccinated. There was a supply issues and many things, and then that we found that it has been regulated, and we have came to the achievement phase, and which we have seen very so smoothly, which is going on. And with these 4 phases, what we have realized that it has been achieved through the voices of the people, with the collaboration partnership of the SHGs, PRI members. They have came forward and they have mobilized their own, their neighbors, helping each other, and obviously the frontline workers. So it is that the Prime Minister who has thought the vision, transformed it through the people of with his own system, and the district collectors and other bureaucrats had took it to the areas, and it's the people who had took the leadership at the local level. It's the panchayats, the SHG leaders, and obviously the local youths, because the COVID entry, registering into that systems, the youths has play a very critical role. So we look into in this way of this vaccination, and obviously there are many challenges, but more than that, we should celebrate this. And that the areas which we look, what was that hard to reach areas. So we have been extensively working with the different district administration to take the vaccine to the hard to reach areas. Those areas which are not covered, even the mobile networks are not available, where the regular services doesn't reach, where it has been which has been cut off through the difficult geographical terrain. And in those areas, we have been mobilized, that identified few of the local young women from the SHGs, trained them, and nearly 300 volunteers are working in 5 districts in Jharkhand, and we have been collaborating with them. So that's all from our side. But again, I would like to reiterate that achieving 100 or 1 billion is the moment of people. They have achieved it, and there is a proverb that if we step down into the road, then the road will show the pathways. So that's the way that once we look into it, we stepped it into with the leadership of the local leadership of the district collectors and that SHGs and women, and obviously the vision of the Prime Minister. But once we started the journey, we have found the path. So I'll stop here. Thank you very much.
Thank you, Shamal. Thank you very much. You sound very spirited, and no wonder you have been featured in a Bloomberg story that I was reading, and how you have been doing some incredible work. Wonderful. I think it is such partnership, such collaboration, such commitment, such coordination and community mobilization that you refer to that has made it such a commendable success. Now, one of the most important panelists amongst us, I'll request Sweta to please introduce Dr. Ravi Mittal, who has created a record of sorts by quietly working along with the likes of Dr. Ting Long. Of course, he's wrote that paper for Medgate. But Sweta, why don't you please introduce Dr. Ravi Mittal to us?
Last but not the least, we have Dr. Ravi Mittal with us. He is an IAS officer of 2016 batch. Today we look forward to listening to his story, because his story is very interesting. Raigad became a district in India which achieved 100% first dose of vaccination, a feat in itself. And despite having limited resource, this feat was achieved. A population of 1.6 million in the district was vaccinated, was given the first dose, and the resources were limited. There was a shortage of first vaccine in India, yet this feat was achieved. Dr. Mittal has experience in a variety of sectors, including infrastructure sector. Currently, he is serving as CEO District Council Raigad, and today he'll be sharing the story of 100% vaccination in Raigad. Dr. Mittal, please go ahead.
First of all, I would like to thank the team of Bureaucrats India, Dr. Anand, and warm regards to all the panelists today in this webinar. So it is indeed a great matter of pride for us. And I would like to tell that we are one of the first districts to complete the second dose as well. And as per the data, I think 2 districts have only completed the second dose full vaccination, and we achieved just 2 days back, other being the Kinnaur in the Himachal Pradesh. And it is needless to say, under the guidance of our Honorable Chief Minister, our district magistrate, that we were able to achieve this big task. And talking about the Raigad experience, first I would like to say that Dr. Tyagarajan, Lakshman, Dr. Shashi Ranjan, and Mr. Shamlal, they reflected on many points which the Raigad focused on. And broadly, I would like to focus on the 5 principles which enabled Raigad to achieve this feat. And these were the 5 principles which we documented with the brilliant Dr. Dai in our paper. So firstly, the Raigad focused on the local leaders. The local leaders were the local representatives. Those are the Sarpanch, Panch, and the Parshads in the urban areas. Since these people have very high level of trust within the community, and along with those, the local government officials. So local officials at the village levels, like the Kisan Sangwaris, Panchayat Sachivs, Gram Rozgar Sayaks, Anganwadi workers, Kotwar, Patels. So these people act as the local influencers. So people have trust in them and people believe in them. Secondly, local leaders in the villages include the networks of women. Those are the self-help groups, the village elders. And we also mobilize the local youth organizations such as the NSS, Nehru Yuva Kendra. So all these local leaders motivated the people to get vaccinated, and they created a kind of positive narrative from the very beginning. Secondly, we confronted the information asymmetry. As discussed in the webinar, there were a lot of rumors going around the vaccination that it may cause impotency or it is not effective, it may cause paralysis. So what we did is we gave a very clear message, a consistent message, and we utilized the media which is local, such as we ran the Tikakaran rep throughout the district, we used loudspeaker on bicycles, and all the messages were recorded by the influential people. This helped us to dispel the myths, and all the rumor mongering was dispelled by using the various local media. And thirdly, we celebrated the small wins. So how we did it is we adopted the elements of the gameplay in our strategy. We basically sorted the progress of the different blocks and the different villages within the blocks in the descending manner, and we marked them as green, yellow, and the red. And since nobody wants to be in red, they were motivated to work really hard more than the others. And secondly, the people in the green, their small wins were celebrated. They were recognized publicly through press releases. The stakeholders, such as the vaccinators, the operators, the panchayat sachiv, sarpanch, they were given the certificates for the appreciation. So it helped us to build a momentum in the district by motivating all the stakeholders to get more proactively involved in the effort. Fourth, we focus on the convenience. Since Raigad is primarily a agricultural district, so farmers go to their fields during the morning. So we organize these special sessions during the evening for them. Similarly, there are a lot of industries, there's coal mining and power sector industries are there. So we organize special camps for them at their industrial sites. And similarly, there are PVTGs, which are the primitive, vulnerable, and tribal groups in the northern part of the districts that is a very hilly terrain and a difficult terrain, remote areas. So we arranged a special group of people who trekked through the mountains, went up to the hills, stayed there all night, and made sure that every one of the tribal group member gets vaccinated, and they came back after achieving their goals. And finally, it was the robust monitoring that helped us. So as discussed by Mr. Shiranjan also, we adopted some strategies from the election management. So during the elections, we see that there is a voting percentage that we see for each of the constituency, different polling booths that are being displayed every hour, every 2 hourly, that this much of people have voted. So what we did is we adopted this strategy for the session sites. We took the real-time data at 11 a.m., 1 p.m., 3 p.m., and 5 p.m. On the progress of the achievement in different sites across the district. So what helped us is in the sites which have low achievement, say by 1 p.m., we used to call them, find out the reason. Sometimes the vaccinator was absent. Sometimes what happened is the vaccines didn't reach on time, or maybe the site was not at the right location for the day, or people were not motivated in the village. So this helped us to correct the course in the real time. And this real-time course correction improved the overall efficiency of our process. And we could vaccinate more number of people using the least number of resources by the robust monitoring. So broadly speaking, these 5 principles really helped the Raigad to become, I believe, one of the 2 districts only in the India right now to be 100% vaccinated with the second dose. And I believe that this Raigad experience has a lot of lessons for the other districts as well as the other nations also in the scientific implementation of the vaccination for the COVID. With this, I would like to thank the team and with warm regards to all the panelists for giving me this opportunity. Thank you.
Thank you, Dr. Mittal. That was truly, truly very, very innovative. Congratulations to you and the team and all those who made this a grand success. And we shall certainly want to have you exclusively with us on an interview along with your district collectors, whenever that convenient. My editor, Rajiv Ranjan Roy, and the team will coordinate with you on that. I had requested Dr. Ting Long Dai of the Johns Hopkins University to please stay back because we wanted to hear after your remarks, Dr. Mittal, about his experiences and where do you see we headed post this, because as Mrinalini was saying, this is not going to go away anytime soon, the COVID problem, and therefore Why don't we hear from a global expert based on his data analytics and understanding of this sector? How do you see this shaping up from here on, both from an Indian perspective, whatever have you observed, and globally also? Dr. Dai, thank you very much for staying back, and kindly over to you.
Thank you, Dr. Anand. And I really enjoyed everyone's sharing of how you achieved your victories. And I salute you, and also congratulations to everyone. I learned a lot. But let me start by saying that I have been an observer of vaccination effort in India, and I have been observing with admiration. And but also in the US, I've been talking with government officials and vaccination planners, and have been writing a lot of COVID op-eds, basically trying to understand how to make vaccination more, this effort more efficient and more effective. One thing I try to emphasize here is we have to focus on the trust between the people and the government. Reason we need a trust is because this is not just one of those battles. This is not a battle, this is a war, and this can take a long time. As many panelists have emphasized, this is not going to end anytime soon. And we really hope this more like the SARS in 2013, like a one-off thing, and be over. Looks like it's not going to be like that. Looks like it's going to be a war. In a war, you need to have a trust from the people for us to be successful. But how do we build the trust? And well, you start with by identifying failures. In the US, clearly CDC and FDA have failed to achieve people's trust, in the sense that there's a lot of flip-flops in terms of whether people should be wearing masks, whether people need a booster, not a booster. A lot of errors have been on the messenger side, but there's also this rigidity in terms of scientific facts. There's a lot of fallacy in thinking. For example, in the very beginning of the COVID-19 pandemic, CDC insisted that it wasn't necessary for people to wear masks because there was no evidence that masks would help people, would protect people outside the hospital setting. Well, for anyone with a little bit of common sense, that's kind of ridiculous, but that was a messaging that people got at the time. So, now we talk about there's no trust or even mistrust from the society. And it's not, we cannot really blame the people. We really have to blame the government, because the government was the one who didn't work carefully to build trust. So that's why when Dr. and Jane and Dr. Savimito, we started working together, I got super excited because I really learned a lot of lessons about how to build the trust from the people. Because when we trust the people, and we can move the mountains. And if we don't trust the people, and we don't cultivate the trust from the people, and we really cannot achieve everything, right? Anything clear. So there's the other lesson I learned from Dr. Mito and also from the leaders in this on this panel is that we really have to think of this way from operational details. Think about it from bottom-up approach, not top-down, right? So obviously the leadership from Prime Minister and from district leaders are crucial. But for the leadership to translate into results, into miracles, we have seen here in India. And I believe there's a lot to do with about mobilize, mobilize the people and to basically understand what's going on at the local level, at the bottom level. And I teach, when I teach at Johns Hopkins, we talk about how do we actually achieve the successes. One lesson here is actually the rules of the Toyota production system, the so-called lean. In the lean method, the key here is actually to be able to trust the people, trust the local leaders, and trust the participants, and encourage people to identify issues, mistakes at the local level, and also fix them as soon as possible. And also encourage people to speak up, to develop this transparent approach into problems so that the small problems do not accumulate to bigger problems. So I feel like when I was listening to your speeches, your experiences with the moderation, I also realized that what you did was really consistent, also aligned with that approach. And also the other aspect is actually to think about, like, for example, Dr. Mito talked about the focus on convenience. That's really one important aspect of a Toyota production system, which is to simplify the workflow. Because if from the design perspective, we created a really giant, complex workflow, then in terms of implementation, it's going to be very difficult for people to realize what they are supposed to do and how they're supposed to do it. We try to simplify things and also build the kind of connection between the people and the government so that they trust us, and also have this problem-solving culture so that everyone has this perspective that they can change things and their voices matter, their opinions matter, they can make the system better. And so this is really essentially what everyone has achieved here, is that you guys are heroes, but really this COVID-19 vaccination campaign is possible because you allow people to become heroes, not just to be passive recipients of the messages from CDC or from FDA. So, so I applaud you. I really appreciate what you have done, and thank you so much for what you have done. I look forward to the next hearing more successful stories from you.
Thank you so much, Dr. Dai. That was very kind of you to have stayed back for this remarkable observations, trust of the people, and the bottoms-up approach. Yes, truly, our heroes are there, and India is so proud of them all. Thank you, and whatever little time you have, if you can stay back, and we'll have 2 more quick rounds. In fact, I'm requesting Dr. Mrinalini Darswal. She also has a virus. It is such a good virus to have of academics. I have never seen a more compulsive, person in pursuit of knowledge and learning as her. So wonderful to have you, Dr. Mrinalini. If you want to have few Q&A sessions, if you can help me with that by asking certain direct questions, my request would be that if we can keep the answers very short, I think it will allow us to then take some questions from the audience. Over to Mrinalini. Mrinalini, Dr. Dai has to leave, so maybe you have a questions for him, one question, and then we can go to other officers and participants.
Sure. Thank you for giving me this opportunity, sir. Before I ask Dr. Dai's question, I must say that today I'm feeling particularly proud, not only to be here, but also to belong to such beautiful cohort of people who are making a difference in the field. And today's panel has been like successful in the sense that it brings in all the challenges our Indian bureaucracy faces in the grassroots, especially in tackling very, very big problems, and how what I am actually learning at Harvard, these guys are doing by experience in the field and so successfully. So there are a lot of lessons in how all of these DMs have overcome natural disasters, reluctance of people, misinformation, even left-wing insurgency, where there's a threat to their own lives, what to speak of others, and the resources are so constrained. So despite all these constraints, we have been able to achieve almost 100% of the vaccinations. That is incredible, guys. You make me like extremely proud to belong to the same service as we do. Dr. Dai, as we were discussing before we started the webinar, that I'm so very interested in the use of AI and business analytics tools for bettering government performance. So if you could tell us some specific ways where India, Tyagarajan spoke about COVID app having utilized to great effect and successful in India. So if you have specific pointers for us as to how to use your expertise and BI and AI and make our effort for coverage for the second dose even better. Thank you.
Thank you very much. And it's quite interesting because I'm actually going to talk to a lot of people about how to use AI to improve vaccination. And also, by the way, thank you very much for your kind words. If you don't mind, I'm going to just share the slides. For this was supposed for different thing, but I'm just going to quickly share what I have here. So we talk about AI a lot, AI, blockchains a lot, right? But really just talks, right? If you look at what we actually do, this is what we have. So this is the most, so-called the most technology advanced country in the world. This is what we do. Everyone got this COVID-19 vaccination record card, sometimes handwritten, sometimes stamped, and you cannot even fit that into a wallet, right? So the reality is brutal. We don't have anything, to be honest. And the way we are doing COVID-19 vaccination is very, very low tech. With the data is not reliable, and the infrastructure is really, really old-fashioned. I spoke with my friend, Dr. Prashant Yadav, who is one of the foremost COVID-19 distributing experts. He told me that actually the infrastructure used in India is actually better here than we do here in the US. But having said that, suppose we have next pandemic, I hope we don't, and we really have to do better. So a variety of ways AI can help vaccinate the world. So first of all, we can do better demand forecasting to minimize wastage and shortage. So this is the one thing in the US is that actually the governments don't know. They don't know how many people need vaccinations. We do not have a national registries such as those in UK or in Israel. Everything is really by hunch, by intuition, by history. The other aspect is to identify prioritizing critical populations to maximize effectiveness, to think about what's the best way to prioritize vaccination recipients when we have limited resources. And there is another aspect, and which is closely related to this one thing that quite a few panelists discussed is how are we going to dispel this misinformation or enhance people's belief? Basically, how do we know it's working? So this is one aspect that we need to connect vaccination with infection control by showing real-time data and showing the infections and hospitalizations associated with the vaccinated people and unvaccinated people, so that people gain confidence that statistically speaking, vaccinations can help people. They may not always work, and you do have breakthrough infections, but overall, people benefit from vaccinations. And this is obviously connected to the next aspect, to fight misinformation through transparent safety monitoring. So oftentimes, our first impulse is to say that we don't want to publicize bad news. We want to focus on good news. But the reality is really the best way to fight misinformation to be relentlessly transparent, to show people what's really going on, to show people, yes, vaccines are not riskless, they are risky, but it's just that compared to the chance of getting infected or getting hospitalized, especially for high risk population, vaccines in any case always provide the best protection. And also to manage consumer brands, platform preferences. I don't know whether this is a problem in India, but in Europe or in parts of US, sometimes the people might prefer Pfizer or to Moderna, prefer Moderna to Pfizer, or sometimes people prefer AstraZeneca to Pfizer. For example, in UK, a lot of people prefer AstraZeneca because AstraZeneca is kind of perceived as UK made. So this is one aspect that the AI could be helpful by look at the trends, look at the database predictions, such that we can manage that to avoid wastage in the supply chain management aspect of vaccination. So those are basically just a few things I have listed. Obviously, there could be a lot more things. So yeah, so I'm going to stop sharing here, and I think a lot of ideas, a lot of thoughts. But let me just conclude saying that right now is mostly people talking about AI, and in the US, and vaccination is largely paper-based system. I know you guys have apps, right? We don't have that. We really don't have that in Maryland in terms of vaccination. So this is one aspect that India can leapfrog United States in many, many ways.
Those are very informative pointers, and thank you also for telling us that we can actually lead the world in this field. Navneet, we have questions from the audience. So do you want me to pick up, because I also have related? So maybe when I'm asking
All right.
question,
I think it will be good. It will be good if we combine your questions along with those of the audience. They'll feel good about it. And why don't I request you to please help us with that section?
thank you. The first question, which is getting, those questions, I think Dr. Bagai was the most suited to answer, and I don't see him on the panel anymore regarding the future. So I will.
He had to leave for a television show. So yes, we have Shashiji, Dr. Tyagarajan, and Dr. Lakshmanan, you,
Oh, yes,
yourself,
they are doctors as
and
well.
Dr. Ravi Mittal. Yes, sure.
I won't hazard a guess. So there is a question that when you encounter hesitancy, and let me tell you that I've been speaking to a lot of DMs on this front, and I have also spoken to Bhim Singh, who is boss of, I think, Dr. Mittal, and picked his brain on how he achieved 100% vaccination coverage, for which you are rightly, celebrated across the country. Tell us, you have spoken about countering rumors and other things. So if I may ask you precisely, tell us one incident where the opposition was the maximum, and what did you or your team do to counter that opposition and then succeed in vaccinating that particular population? Thank you.
Yeah, that's a very interesting question. In fact, there's one example, one incident I could think of was in the village Bhikampura, that was in the Baramkela block of our district. So there was this particular, a lot of people in the village, who were not willing to, vaccinate, and we tried for more than a month and a half, and they were still not very much willing. So what we did is we, as I said, targeted the local leaders. So we asked the Sarpanch to get themselves vaccinated, get their families vaccinated. And if you see the presence of government in the villages, so there are more than 15 and 20 people at the local level who are the government employees. They could be the teachers, Anganwadi workers, Ashas, Mitanins, Kotwar, Patels, hand pump operators, Kisan Sangwaris, and so on. So there are a lot of 20, 25 people at least at the village level. So we asked them and their families to get vaccinated. Then after that, we proceeded with vaccinating their neighborhoods first. So we asked them that since you have got vaccinated, your families have got vaccinated, and there is kind of social connect in the village. So why don't you motivate your neighbors to get vaccinated? So what happened is the kind of fear of unknown the community had in that particular village. Once they saw that a lot of people are getting vaccinated, so they themselves got motivated. And specifically in context of the developing countries, what has been shown by research is people generally take decisions based on trust. That is, they take cues from their leaders, and they would like to do what they see their leaders doing. So this has been very much documented in the research by Sheena Iyengar in Art of Choosing. So that's how we adopted the strategy, to set lots of examples within the village so that there is no confusion, there is no sense of mistrust among the people. So this is the one example that I would like to quote.
That is an excellent example, and that in here lies a great learning for all of us also who are working in the field. So my next question would be, our audience, I'm sorry audience, I'm not able to take all of your names, but I hope I cover all of your questions. People have expressed their concerns about filling the gaps in education. Children have lost millions of school days. And also there is an audience question about employment and economy. So any of the DMs would like to speak on education, and then I would have another DM speaking on what steps are you taking for resetting the economy and providing employment during COVID-19. And I hope, Navneet sir, I'm not digressing from the issue here.
Perfectly fine. Absolutely.
I think Dr. Tyagarajan can answer the economy one. He's doing some wonderful job in Darbhanga for employment generation.
Excellent. Dr. Tyagarajan? I believe he might have taken a short break. So if Dr. Lakshman is here, we would like to hear, he has done like tremendously well too, especially when faced with floods. I'm a doctor, like I say blood more commonly than flood, I'm sorry. Dr. Lakshman, would you like to tell us what steps your district's been taking to help people tide over the economic crisis during COVID?
Yeah. Thank you again. During the COVID, especially during the first phase, the starting of lockdown was very, very immediate. So what happened? People did not get much time to be accustomed or be prepared for facing a comparatively longer period of lockdown. Initially, it was for 3 weeks, which got extended for another 3 weeks. It was almost 6 weeks of wholesome lockdown. Then partial lockdowns in various states, which was at that point of time not much synchronized. So the state government had to come forward with multiple financial assistance schemes. At that point of time, our current chief minister, sir, was health minister at that point of time. With the state government's budget, Assam came up with 3 different financial assistance programs. One was for the people of Assam who were stuck outside the state. So for them, initially 2,000 rupees and then subsequently another 2,000 rupees for more than 7,96,000 families. Around 8 lakh families were supported who were stuck outside the state of Assam. This financial outflow, it was for approximately 155 crore rupees. But these were released in the month of April and May 2020. The lockdown started on 25th of March. So this actually helped that many people who were stranded, and this was through proper DBT only. It was absolutely through DBT and through a very, very transparent online application, verification, clarification, and release of fund process. The second was for people who went out for treatment, but stuck up in different hospital outside the state. So 25,000 rupees initially and another 25,000 rupees again was given to approximately 800 patients of various diseases, mostly cancer, who went out. This also helped a lot of people to continue with their treatment despite they were unable to come back to our state. And the last set was for those people from Assam who were outside India even. Here the number of students or people who went out for some particular reason, business or tourism or whatsoever, they reached out to the state because state was having a scheme. And for that also we gave out $1,000 initially and another $1,000 twice. So all these financial direct beneficiary assistance help to prevent large scale reverse migration to our state. As you already know that Assam is one of the states from where people go out for working, especially in southern states, Maharashtra, etc. So this was one method of helping people outside the state. Now coming inside, lockdown means the people within the state were also locked. So immediately one of the first step was to ensure that all the items provided under NPS, this NFSA and ration system were made sure that at every doorstep we are delivering the NFSA items. At the same time, government of Assam had came up with a very innovative scheme called Arunodaya scheme. Our current chief minister, sir, was at that point of time holding finance department as well. Hence there was proper assimilation between both health and finance department. And at that point of time, finance department came with a scheme called Arunodaya scheme, where depending upon the earning female member of the family, monthly fund release on DBT basis were started to more than 25 lakh families within the state. So this initial amount of 890 plus rupees every month, and which is subsequently growing up, This also helped to face the financial issues. Initially, it is not a big amount, but it really supported. Then we also made sure that medicines, especially those which are available in the essential drug list for non-communicable diseases, were also given door to door as per the request made by different people. So a particular scheme was launched for this called Dhanvantari. So all in all, whether it was for economic activities or financial assistance or for food or for medicine, state government came up with own schemes. At the same time, we also worked out in such a way that once we were withdrawing the lockdown, bringing it down to curfews, then managing curfew hours, the state government was absolutely aware that a state like Assam can take stoppage of economic activity to one particular level, but safety of all citizens is much more than the economic hit which the state will take. Considering all these aspects, and definitely government of India also provided a lot of support at that point of time, the economic difficulties were managed. But more important to that was the threat of flood as well, since that was a question which I saw in the chat as well. There were continuous meetings with revenue department and health department. In Assam, floods are annual phenomenon. We knew all the deputy commissioners or all the civil servants who work in Assam understand the threat and importance of flood season. And there was a very conscious effort to identify flood prone areas, early planning for flood relief shelters, and there was an active effort to vaccinate those people in those areas initially. Despite the vaccine deficiency, we were planning it in, this is for this financial year I'm speaking about, because last year we did not have vaccines. But this year we made sure that most of the flood prone areas in Brahmaputra Valley, which are close to the river, those locations were taken up for vaccination pretty early as well. And even during the vaccination, even during the relief camps, we made sure that the inhabitants are getting at least first dose vaccination on preference. All in all, Honorable Chief Minister, the various departments, revenue and disaster management, health department, general administration, food and civil supplies, finance department, all were absolutely together in this management. Hence, from the health department side, we never felt that much pressure upon us. And a lot of credit goes to the way the state administration managed that. Thank you.
That is brilliant. And let me tell the audience that DMs in India are the leaders for everything, like everything that touches your lives. I love to say from womb to tomb, DMs are the people to go to. They manage our lives in the districts. And also any question you have regarding anything, anyone among the people who are there on our panel are equally capable of answering each and every question. So one of you, please feel free to allay audience's anxiety about missed education. We all have kids and we all have suffered because of that. So some soothing words and some hope coming from one of the DMs is certainly going to help all of us. And that includes you, Dr. Mittal, because you'll be DM soon. Dr. Ranjan, would you like to take this question? Just shortly, because I think we might be running out of time here.
I think there was a little voice break, so can you just brief the question again?
There is a question in the audience that children have lost almost an entire year of academics, school education. And what are the steps being taken to compensate for that? Or will they ever be able to actually compensate for that lost year in future? What are your views and what are the steps?
Yeah, thank you. That's actually very interesting question. And if you see what we are realizing right now, because there is a very little time left and a lot of skills, the children miss during the COVID, although there are a lot of technologically different innovations were made like Padhai Tua Dwar and different e-ways of learning, but still that was not even close to what the children learn in school. But the very interesting fact right now we are seeing is that with the very less time, the curriculum is being revised. And the revised curriculum at the higher levels, it is being realized that a lot of things were not really very necessary for the curriculum, which extended it for so long and burdened the kids with so much of information. And so looking the education sector, not in terms of knowledge, but in terms of concept-based learning. So all those aspects are being, rediscovered, and the concepts with the children who, the kind of concept they missed in their last class or maybe for this academic year. So what the administration is doing is, just checking up with them how much each child has been able to achieve, and just working with each child on how we can make sure they are able to cover the gap. So that is pretty much the two basic lessons that the COVID has given us for the education, and that's the way forward. The government is looking to make sure there is no gap in these skills.
Yeah, Namit sir, I hope I have covered all the questions in the chat. And like final words, I must say that COVID has not only impacted our health and has been a threat to our health, but it has actually been a threat to our livelihoods and our education as well. And we need a concerted effort where we, like I said, we are fighting this battle on multiple fronts. And the DMs are our frontline soldiers. They are actually the commanders in the field. And all of us together I again welcome everybody to join the hands of our Honorable Prime Minister and really defeat this enemy as soon as possible. Over to you, Namit sir.
Thank you very much, Mrinalini, for helping us with this session. Who better qualified than you to take those questions, filter it for us. And there are many other questions, my dear ladies and gentlemen. Sorry, we shall try and answer these through our tweets because we are well over 120 minutes and it's been fabulous to hear all panelists. They have very, very patiently been with us, helped us to learn the finer nuances of what it took to achieve this brilliant success that we are celebrating today, and where do we go from here. Thank you all very much. I'll request Sweta to do a formal vote of thanks, and see you sometime very soon again.
Thank you very much to all the panelists who sat through this long session. Despite their busy schedule, they made out time. Mrinalini ma'am joined us early morning and she woke up at 3 a.m. to prepare for this webinar. Other panelists had meetings and they made time for this webinar, particularly this webinar. Today, we heard the story of India's 100 crore vaccination journey, a journey that went from anxiety to assurance, a journey of 1 billion vaccination in 300 days, something that people of India initially thought would take 3 to 4 years. A stupendous feat for India. And our DMs, our IAS officers, our IPS officers, our bureaucrats played a pivotal role in driving this vaccination drive. And we cannot thank them enough for this. Thanks to our audience for sitting through this webinar, asking questions, and patiently listening to all our panelists. Thank you once again. Thank you to all our panelists for sharing real life experiences, something that we have read about, something that we might even not be aware of because of all the hard work that, as Mrinalini ma'am rightly pointed out, DMs, the kind of work they do, many of us are not even aware of the work they do every single day. So thank you very much for sharing those real life experience. I thank all my audience for sharing the questions. Those who have questions and whose questions haven't been answered, you can write to us at bureaucratsindia@gmail.com. We'll try to answer it via them. Or you can tweet to us at our Twitter handle @bureaucratsind. We'll try to respond on our Twitter handle. You can visit our website, bureaucratsindia.in. We'll soon be putting up a story related to this webinar, so you can get all the key pointers of this webinar over there. Once again, thank you very much. Have a good night and see you soon.
Thank you very much. It was great meeting all of you. Thanks.
Thank you.
Thank you very much.
Thank you.